right, welcome back to my channel. Dr. Moses here again. On today's episode, I want to talk to you about the medical evidence of using clove oil in dental medicine. The evidence of using clove oil in dental medicine. Now, if you look on the internet, you have a lot of information about how to use cloves and some of the properties that it has. But today I want to give you the medical evidence why cloves can be used in dental medicine. Now, clove has an ingredient called eugenol, E-U-G-E-N-O-L. And this is the ingredient that has the properties that cloves have to be able to help in dental medicine. Number one, it has a natural anesthetic property. And what happens is that the effectiveness of this anesthesia is compared to benzocaine. Benzocaine, it's an anesthesia for that is used in dental medicine. Okay, and what the second property that cloves have is anti-inflammatory property, and the third property is the antimicrobial or bacterial and antifungal properties. Now you can see below my video description, you can see the evidence in PubMed. There has been an article in PubMed that explain these properties. Okay, what is the mechanism of action of the anesthetic effect of clove? Now, eugenol interacts with the pain receptors, therefore providing a numbing effect and on the area that is applied. That is how we see the anesthetic effect of cloves. And the anti-inflammatory effect, it works by eugenol, again, inhibiting the production of pro-inflammatory mediators like prostaglandins and cytokines, which are involved in inflammatory response. So basically, it inhibits these effect of prostaglandins and cytokines, and therefore giving you the anti-inflammatory effect. Now, in 1837, there was a scientific discovery by the Dental Association, and they use a substance called ZOE, or zinc oxide and eugenol, for using it as a filling material for root canals. And they actually found that these work better than all the other materials in using as a filling material for root canals. And in 2024, in February of this year, there was actually a clinical trials, and again, I have the link in the description here below, clinical trials where they compared ZOE, and then they also use zinc oxide powder with aloe vera gel, and also they use another called endoflask powder. They use all these three combinations as an obturating material in primary molar. In primary molar. Okay, so this is what happened. These three different materials, and after 9 months of following the patients, they realized that of all the three materials, the zinc oxide and eugenol give a better result than all the other two material. So as you can see, there have been a proven scientific trials on the use of eugenol in dental medicine. So how do you use clove as a home remedy for dental pain? Now, it's very important that you use it the right way because of the toxic effect that clove can provide if it's used, if you overuse it or if you use it excessively. So what you're going to do is that you want to perform what we call the patch test. The patch test is when you take a little bit of the clove oil. So you get a clove oil, which contains the eugenol, and you put it on your skin, and you allow it to stay there for about 24 hours, a little small area, and see if you have sensitivity to eugenol or clove oil. Because if you have allergic effect to it, you don't want to use it, okay? So that's very important. And if you do that and you are not sensitive to the clove oil, then what you want to get is that you take about 1 to 2 drops of clove oil, and then you mix it with either coconut oil or with olive oil. So you take, just say, 2 to 2 drops of clove oil, and then you take about 10 drops or 10 to 15 drops of either coconut oil or olive oil. You mix that together, and then you take a cotton ball, all right, something that is clean, you dab into it, and then you put it around the gum and the teeth area where you have the pain or you have the chronic inflammation of your gum. You leave it for about 5 minutes, okay, and then you remove it. Now you want to, after a while, you want to wash your mouth. You don't want to swallow that combination because it's going to be very toxic to your body. And you do this a couple of times a day, continually, and you see that because of the anti-inflammatory property to heal the inflammation of your gum, and also it will numb the place up you have pain, and the pain will go away. Now, there's a risk and also side effect of cloves. The number one is that it's very toxic when it's ingested, so you should not swallow the clove. And number two, it should never be given to children. And also, pregnant women and breastfeeding women should not take cloves, okay? And also, if you're on a blood thinner, you should not take clove because clove can thin your blood. So if you're on a blood thinner, warfarin, or Eliquis or Pradaxa, any of those blood thinners, you do not want to use cloves. And also, if you are going to have surgery, you should not be using cloves because it's going to thin your blood and going to bleed some more. So you should never use clove if you are going for surgery. And the last, and not the least, is that clove has been found also to reduce your blood pressure, blood sugar. And so if you're using insulin or you are diabetic, taking medication, you don't want to use clove because it can reduce your blood sugar. So these are some of the ways that you can use clove in dental medicine. Now, if this has been helpful to you or you have any comments, you can subscribe to my channel, give me a like if you like this information. And also, if you use cloves and you have benefits of it, you can leave your comment below for our readers, and so that they can also benefit from it. Again, until then, I want you to stay well. This is Dr. Moses.